Training is your first step in your training that we specifically have you do with doctors for your orange training, because we're going to talk about a few things that you actually do on behalf of the doctors, and that's why the doctor comes in and does part of the training. Okay, we're going to focus on the report card today, though, and what's entailed in the report card, so you can feel prepared to start doing that with your patients. Okay, and you've probably seen the other staff do it up to this point, and it's pretty straightforward as far as what's on here, as far as the information at the top, their height and the weight, and then the hygiene sort of grading, their ortho grading, and their appointment on the back, and their homework, and their next visit. So it's all basic stuff, but I want to go through some of the details with you so you feel comfortable in being able to do it on your own. Okay. The first thing we're going to talk about is this side over here, this left-hand side, the cavity risk and hygiene grades. Okay. When it comes to you doing your orange training, we want you to feel comfortable in starting to polish a patient's teeth. Okay. And that's one of the really cool things in Texas they allow dental assistants to do, is actually do what they call coronal polishing and polish a patient's teeth, which the doctor then comes back and checks to make sure you've done a good job. Okay. And the polishing of the teeth basically consists of cleaning all the teeth that are above the gums. Okay. Any plaque, any buildup, or anything like that that's on there. Okay. And so you do that with a little rubber cup prophy, which you'll get to learn to do. And really, I'm not too worried or concerned about you learning how to do that. It's pretty straightforward, and the staff will show you tips and tricks on how to hold it, how to position yourself, how much toothpaste to use, all those little tricks to help make sure you do a good job. In the end, what I care about, one, is that the teeth are cleaned. All right, and where you start, where you end, or however you do it doesn't really matter to me, as long as in the end they're all cleaned up. Okay. And also you go in there and of course you floss in between and kind of clean all teeth up that way. And so over the next day or two, as you are practicing this for the first time, that the doctor that comes up behind you will be watching to see how you've done, hopefully provide you some feedback. And the two places that are the hardest to kind of really get to when it comes to kids and polishing their teeth is around the upper back molars and kind of this lower front area. Okay, so those are the places I usually watch when I'm kind of just double checking someone, is if they're kind of got this area clean and the back area is clean. Okay. So that's all I'm going to be doing, is just watch to make sure you've done a good job cleaning those teeth, okay? But the second really important thing that's, I feel like part of this process, is that you're a good chance to really provide education for the parent and for the child about how it's going in their mouth, okay? And what they could be doing better, okay? That's really where the value comes. Yes, they get their teeth cleaned, but two, they learn something maybe more about their smile and what they can be doing to do a better job with it, okay? And we communicate that primarily through verbal and through this written format here, okay? So when a kid comes in, there's basically 5 categories of questions we kind of ask, and you do not have to sit down and kind of read one by one and answer, yes or no. You're going to get a feel for that as you see them and talk with them. But you are going to grade them in each one of these categories, and then at the end of that, you'll give them an overall grade A through D as far as what you feel like, as the teacher, things have gone forward and what they need to be working on, and what their grade is for the day, okay? And again, the questions are pretty straightforward. Your trainer will walk through those with you, but I want you to feel comfortable and confident with that, okay? With that, of course, on the back side, we've got the homework assignments and then tips over here. And these are the things we're specifically going to have them focus on, and you'll write that down. Maybe it's just flossing, maybe it's making sure you brush in the morning as well, or using a fluoride toothpaste, whatever it is. You'll write a couple homework assignments for them to keep working on at home. And then if you're really kind of stumped, you can use some of these if you need to as kind of like backups. But these are just general tips we offer to everyone, okay? So that kind of covers a lot of what's on the report card. But again, as a recap, for me, when it comes to polishing, it's one, making sure all the teeth are clean really, really well, and then 2, they get some educational piece to it, so they walk away feeling more confident how they can take care of their smile. Okay, so that's it when it comes to the polishing and coronal polishing and the hygiene side of things. Okay, and again, ask lots of questions. It's good to have multiple people kind of show you how they do it, how they hold the handpiece, how they position, where they start, where they end, so that you feel comfortable doing all that stuff. Okay, so there's that. All right, awesome. Now, the other part of the report card is the ortho grading scale, okay? Next to probably, does my kid have cavities? The number 2 question we get is, does my kid need braces, all right? Some kids are too young to even know. Some kids are on the path to kind of get there and we're not sure yet. And some kids, we can definitely give them a firm answer. But the truth is, what we are really intended to do as pediatric dentists is help parents get an idea of how their growth and development is going and where they're tracking. And so that's how we communicate this to the parent, is through the ortho grading scale, all right? We start doing this part of the report card when a child gets their first set of adult molars in. And that usually happens at age 6, all right? So we call them the 6-year molars, all right? And that's when we start grading this. Before that time, if they don't have 6-year molars in yet, we just draw a smiley face on this section. It's really simple, okay? Or if they're already in braces, we draw a smiley face on this section because their teeth are changing. There's no reason for us to really grade it, okay? But it's that in-between time that we really do the grading scale for them, okay? And there are 6 components to this evaluation that we do, okay? And we give them a rank at each one. And I'm going to go through each one of those with you so you feel comfortable with them, okay? The first things that we look for we call molar and canine classification, right? And that really basically comes down to how teeth relate to one another in their bite, okay? So, for example, this is just a model of our mouth here, and the first molar is this first big adult tooth right here. And when this bite comes together on this model, you'll see it comes to where the top molar, especially that big front cusp, bites right down into the middle of the lower molar, all right? That is what we call a class 1 bite. So if a patient has that bite right there, you're going to circle a 1 for the molar classification. Now, a class 2 bite is a bite that actually is one step ahead of that, and it looks like that, okay? The molar is one step ahead, the top tooth bites right in front of that tooth, okay? And a class 3 is the opposite. It bites behind it, okay? Now, it would make more sense if it was just 1, 2, 3, but it's not. It's 1, 2, or 3, okay? And so when it bites behind, that's called a class 3 bite, okay? And that really dictates how jaws relate to one another, is where that molar bites, okay? And we classify them as a 1, 2, or 3. Now you also see we have on here we call a cross bite. That's kind of the worst thing you can have. And that's when this tooth actually, instead of biting in the middle, the front, or the back, actually bites to the inside, all right? And when that molar bites to the inside and this molar is sticking out, then that's considered a cross bite. That's the worst thing, okay? So that's how we determine if it's 1, 2, 3, or cross bite. Now, canine is very similar. It's just how the canines relate to one another. And of course, as you look at the canine, which is this big pointy tooth right here, it relates to the bottom canine. If it bites one step behind it, kind of right on that side of the tooth, that's considered a class 1, all right? You'll notice oftentimes when there's a class 1 molar, there's a class 1 canine. They very often relate to each other, okay? As soon as that molar bites into a class 2, usually it shifts so the canine is out in front, and it is also now a class 2 canine because it bites out in front of the bottom canine. If it bites all the way behind, on the tooth behind it, then we're in that class 3 bite again, okay? And so that's what we consider 1, 2, or 3 when it comes to the canine. Now the other thing we have on here is 1, 2, 3, or missing, okay? The upper canines are the last teeth generally to grow into your smile as you turn into your teenage years, okay? And sometimes if you have enough crowding in there, the last tooth tries to come in and there's just not room for it to go in, so it gets stuck and it doesn't come in, all right? So if that tooth is not present, it's not come in, it's missing in action, then we consider it missing. And again, that's the worst situation to have, and we don't have a classification, it's just missing, okay? And you would circle whichever one of those classifications are missing in your patient, okay? So that's molar and canine classification, okay? Now, next is overbite and overjet, which kind of go together, okay? Overbite and overjet are basically how the upper teeth and the lower teeth relate to one another, okay? Overbite is how much the top teeth bite over the bottom teeth, so it's kind of this relationship, okay? Overjet is how much the teeth stick out, so it's this relationship, okay? And how horizontally, how far they stick out. So like a jet flies horizontally, overjet is that distance, okay? So how we measure those is this. Our lower front teeth are about 10 millimeters tall. And I don't expect you to know how big a millimeter is, all right? Just know that it's about 10 millimeters tall on the bottom, okay? So if a kid bites down and their top teeth bite down, and just like in this patient, it overlaps about half of the bottom teeth, then how many millimeters would that be? Half of 10 would be 5, right? And so use that as kind of relationship in figuring out how many millimeters the overbite is, okay? If it's just barely overlapping, you know, it's like maybe 1 or 2, or if you can't even see the bottom teeth, you know it's 10 or more. So you use that as your way to kind of figure out how many millimeters are there. And here we have a 0 to 2, 3 to 5, or a 6 plus is your values, okay? And you'll circle whichever one seems to match up with your patient, okay? Overjet is the same way. We're measuring the amount of millimeters the teeth stick out between the bottom teeth and the front teeth. So it's basically how big that gap is in that area, all right? To measure that, we use our mirror, okay? And the mirror is about 3 millimeters wide, okay? So if you put it in there and it can bounce around, there's all kinds of room in there, you know you've got way more than 3 millimeters. In fact, you probably have 6 or more millimeters, okay? If you put it in there and it barely just snugly fits in there, you know you're probably in that 3 to 4 range, so you're probably in that 3 to 5 range. And if you can't even get it in there because it's so tight, then you know you're less than 3 and it's 0 to 2, okay? So that's how you can measure that distance inside there as well, all right? Now you can see beyond the 6 plus, there's also a crossbite situation, and that's when those teeth actually don't even bite on the outside, they bite on the inside, like this, okay? And when that's the case, and you have a front tooth on the bottom that is in front of the tooth on the top, then you're in a crossbite, and that's when you circle, okay? And if you have crossbite for overbite, you have crossbite for overjet. They go hand in hand with each other, okay? However, the numbers do not. You might have 0 to 2 of overbite and 6 plus of overjet. Those can be different from each other, okay? Last off is crowding and spacing. Those are the last two things you measure, okay? In this patient, what we're looking at is basically how much room they have or lack of room they have in their arch, okay? In this patient, all the teeth line up perfectly straight. They touch one another and there's no gaps, there's no spaces, so they would have 0 crowding and 0 spacing, all right? Most people aren't that way though. They might have a little bit of each or some of one or some of the other. And basically what you're looking at in crowding and spacing is how many teeth or lack of teeth are required to either fill the space or they would need to make their smile look straight, okay? So as you look down here and you look inside and say, well, those teeth are straight except for these little couple teeth in the front, they overlap just a tiny bit. You'd probably say to yourself, oh, they need about a whole half tooth worth of space for those teeth to fit, all right? Then you would circle a half on the crowding because they're a little bit crowded. Or if you see a kid, they come in and they have a great big space in their front teeth and maybe a couple other spaces in there, and you're like, wow, you could almost fit like 2 more teeth in there, all right? Then they would have 1 plus on their spacing, okay? And that's how you kind of measure. It's just an estimation of what you feel like of how much crowding or how much spacing you have, okay? And then you circle whichever one's appropriate, okay? So let's say you've gone through all these things. You've got a patient who's a class 1 molar, a class 1 canine. They've got 3 to 5 of overbite, 3 to 5 of overjet. Maybe they've got 0 crowding and half on their spacing. Okay, let's say that's their score, okay? What you then do is you add all these up to get an overall score. Anything in this column is worth 0 points. Anything in this column is worth 1 point, 2 points for this one, and 3 points for those ones, okay? So here you got 0 points, but you've got 1, 2, 3 points for the rest of the scale. So they have an overall score of 3, which puts them in that range, okay? And it gives them what we consider a B bite, which is one that's not a bad bite. It's got a few imperfections, but not a ton, all right? And typically kids that have A's and B bites, we don't really push them towards braces unless they're just dying to do it, and that's what they really want to do. Kids who have C and D bites, we oftentimes push them towards getting braces because they have significant needs that would really make an impact on their smile in their life, okay? And that's how you felt a grading scorecard. Now that was a lot to go through and a lot of explanation. What you're gonna find out is after you practice this and do this quite a bit, you'll be able to kind of go through this and do all of that in about 15 seconds, all right? It's really fast. You can look at your polish and cleaning, you have a good sense where the bite is, you circle, score it, and it's done. And then you are in a good spot where you can answer the parents, did my kids need braces? You say, well, right now they kind of have about a B bite. That could change as they grow or whatever else it is. And you can answer just basic questions for them, okay? If a parent really ever seems to be extra concerned about that braces question though, you definitely relate to the doctor and we will add on to what you've added on by looking over their bite and seeing how things go, okay? So with that information here, you should be able to basically do the full report card and do that next step, all right? You'll be kind of really doing that polishing and evaluation and oral hygiene instruction for the doctor, and you're also doing that grading scale for the doctor too, okay? And then you relay that information to us, so when we talk to the patient, we can kind of back you up and add to whatever we might need to, all right? Make sense? Okay, there it is. You got it.